Hello, and welcome to Pre-Hospital Trauma Care. Today, we will be talking about hands-only CPR. Hands-only CPR is designed for the untrained lay rescuer or someone who isn't comfortable or confident giving mouth-to-mouth resuscitation. Research suggests that hands-only CPR is most effective on adults, as cardiovascular problems are often the cause of their cardiac arrest. Whereas in children, the majority of their cardiac arrest events have to do with respiratory deficiencies. And of course, performing full CPR, a combination of 30 compressions to 2 rescue breaths, is always going to provide the best chances for a positive outcome. However, hands-only CPR is better than no CPR at all, even on children. How to provide care. The first thing you want to do is make sure the scene is safe and begin calling out to the victim to assess whether or not he or she is responsive. Are you okay? Can you hear me? If you don't get a response, proceed with the following steps. Call 911 and activate EMS. Put your phone on speaker so that dispatcher can assist you. Locate the area over the heart to begin chest compressions between the breasts and on the lower third of the sternum. Stand or kneel directly over the patient's chest. Lock your elbows and use only your upper body weight to supply the force for the chest compressions and count as you perform them. Conduct compressions that go 2 to 2.4 inches deep for adults or 1/3 the depth of the victim's chest and at a rate of between 100 and 120 compressions per minute, which amounts to 2 compressions per second. Continue to perform chest compressions until help arrives or the victim is responsive and breathing normally. Once you perform a chest compression, make sure you allow for full recoil of the chest cavity. You want to allow the chest to come all the way back to the neutral position before performing another compression.